All right. Thank you very much for joining us.
You're welcome, Sam.
Thank you. So, thank you, viewers, for joining us today on the first edition of True Talk with Sam this year, 2025. And I must say, Happy New Year to you guys. And thank you for staying tuned with us all through the year 2024. And we're starting a new year, bigger and better. And I hope you're going to enjoy all of our videos and all of our sessions that we're going to be having this year, 2025. And also in our Journey So Far series, we're here to talk about what I wish I knew. We were having two guests today. We have Yahya Ahmed, and we'll be having Joseph Ige. So Joseph will be joining us later on in the program. But currently we have Yahya, who is here to share his journey and to share what he wished he knew as at the time he came to the UK. Yahya, welcome to the show today.
Yeah, hi, Sam. Yeah.
Thank you very much. And if you are new to the channel, guys, please hit the subscribe button. We've made so many videos, and I want you to revisit them. They're actually good resources for those who have relocated to the UK, and for those who are struggling to adapt and settle well in the UK. We've made several videos, and we've had some live session also on this program that would help you settle and adapt well in the UK. And today, I would want my guest here to kindly just introduce himself briefly, so my guest will know who they are talking to or who are expecting today.
Yeah. Thank you, Sam. My name is Yahya, and I'm from India. So it's been like 3 years since I came to UK. More than 3.5 years, probably. I came in August 2021. So before that, I completed my bachelor's in nursing and was registered as a nurse in India in 2011. Uh, After that, I went through like different sort of jobs, working in the hospital and working as a teacher, and ultimately ended up here now in the UK. It was quite a long journey, like from 2011. Went through different sort of experiences, and this has been like a entirely different thing what I've been doing in the past.
Yeah. So currently, I know Yahya is a deputy charge nurse at the university hospitals Derby and Burton. Is that correct?
Yes, yes, yeah, yeah,
Yeah,
yes.
you've gone so well, and you are doing so well currently.
Oh,
Can you
thank.
just give us a brief how you began your nursing career? Can you just tell us how you started your nursing career?
Yeah, so I was registered as a nurse in 2011, as I told you. So soon after completing my course, I joined the same hospital where my college was attached to. I had experience from there, mostly in the surgical field. I worked in the neurosurgery,
Okay.
neurosurgical ward, basically, not in the intensive care units. After that, I decided to take on teaching. So I went on teaching for like almost uh, eight 8 years. I had teaching.
Was the
Yeah,
teaching related to nursing? Was it nursing
yeah, yeah,
education
yeah,
or what?
yeah, yeah, yeah. It is. I taught nursing students. Yeah,
Oh, okay.
yeah.
Yeah.
Because my mom was a teacher, I was more passionate being a teacher. Yeah, yeah.
Yeah. Okay.
And
So what made you come to the UK?
uh, about the circumstances back home, it was basically one of the main reasons was obviously the pay.
I see.
You
So
know,
yeah, you like money too.
yeah, yeah. Obviously, we have learned quite a lot. It's a struggling course. It's not an easy course to do. You see, nursing is a bit hard back home. Like you have to go through like 4 years. It's a 4 year course. Additionally, you have to do an year of internship as well, which is not counted
Yeah,
as your experience. So it is really, really a big course, and you have done quite a lot of work uh, to get certified as a nurse. It's not an easy
yeah,
thing back home. It's a
definitely.
big struggle. So you expect like to be paid because um, uh, you have gone through a lot of things. That's one of the reason. Besides that, the other reasons that took me to UK was the career prospects. Like, the things. There are not many diverse, uh, you know, nursing careers back home. Rather than being a registered nurse, there are not much specialities or no advanced, no career advancements.
Yeah,
It all depends on the experience. Your experience for like 5 or 6 years, you get into a supervisor role, and then after that you get into the nurse manager role. But the CPDs, the advancements, the latest things that's going on around the world, you're not used to it while being back home. There are not much opportunities to learn. So
yeah,
what attracted me to UK basically was one of the reasons I told you is obviously pay is definitely a thing, because that's what we depend on from for our day-to-day life, our family. And it's very important. It's very important. And besides that was the career prospects, like, and opportunities for learning.
mm,
So while I was nursing, I completed my nursing. I was a bit enthusiastic to see how the nursing profession evolved. And one of the thing that caught my attention was the nursing evolvement in the UK, because uh, I was more into the uh, nursing union side. I used to be part of the union. I was founder of one of the unions back home. So
okay,
I had to learn a bit of historical background of how nursing evolved throughout the world. And nursing in UK, they really had a struggling time, and they did like lots of things to bring dignity to the profession.
yeah,
The cultural, there are, so when you work back home, the way people see you is like, mm, most people doesn't like the way people see you as a nurse. But things here,
we're not
uh,
respected back home
yes,
as
that's what
nurses.
the
Yeah,
term is: respect and dignity of doing
exactly.
your job. So in
Yeah,
here, you are respected. You are respected for whatever job you're doing, not only nursing. Whatever job you do, you get
yeah,
that respect. That's one of the motivational things that make you going, that keeps you going forward. You see, it gives you the energy to work. Uh,
yeah.
so while going through the history of nursing here in UK, they've got like a very fascinating history. Even if it's like asking for a pay rise, or fighting for their rights, things were almost of the same kind, like 50, 60 years back in UK, as like we have in our home places. I don't know how exactly it's in Nigeria,
Yeah, it's
but
still the same. We're not still respected. The pay is really very bad. So it's
yeah.
still
And
pretty much the same.
so we are not allowed to raise the rights of nurses. We are considered like a group of people who always want, need to be uh like someone who who always does the work and not
Yeah,
being
yeah.
praised for what you're doing.
You don't have a say. So
Yeah,
um, let's just be factual here. The doctors just make the
yeah,
decision, and you are just to implement it. You have to carry it
yeah.
out. You don't have a say. That's what happens back home.
Clinically we learn quite a lot of things. I remember speaking to you once regarding the different aspects we learn, like the pediatrics, the mental health, the gynae side. We learned quite a lot, but then we are not appreciated for what we are doing.
Yeah,
Rather, we are made to do like lots of jobs. Here it is restricted. In UK it's more restricted, like you only need to do what it says in your job profile.
that's true.
You don't need to go beyond, like beyond your professional things. Like, You can
Mm,
go beyond lots of things, but not professionally. The job that you're assigned to, you're not allowed
sure.
to go beyond or below that. Like you need to be what the NMC says you to be. That's what is expected from you, and you are appreciated for things that you do as well. So these are
Okay.
some of the things that made me choose a career here in UK.
So when did you arrive in UK? And how has it been since you arrived? What challenges did you face?
Yeah, it was. I came in around like soon after the COVID was on the the final phase of COVID, like around 2021.
Yeah.
um, it was a bit difficult those times because we had to go through lots of screenings, vaccinations, and all the stuff for each and every travel. Back home, I had to travel quite a lot because of the appointment delays and all the stuff. Uh, but I would say my journey towards the UK, the day I came in UK, everything was streamlined. Everything was
Okay.
streamlined and it worked well because I go through the stages quite quickly. You pass the exams and stuff.
Mm,
It was a delay only due to the COVID, the flights and all the stuff. So the trust that I came to, they've provided me with quite a lot of facilities when I came in. I don't know whether it's available nowadays, but then we had so I came in August. I had my OSCEs on mm, September, around September. So we had like 4 weeks, 4 weeks of OSCE training
yeah.
without clinical. You don't have
Experience.
had to go to the clinics. You just had to attend the training. So that was a good thing that I had back then.
Mm,
So there was like a 4 weeks continuous training for your OSCEs because things are quite different, from back home. So you have to
yeah.
learn like lots of things. Again, regarding the OSCEs, it's not what the things are like. You learn for the OSCE, but that's not the thing that you see in the clinical side. It is different again, isn't
That's
it?
true. Yeah, it
Yeah.
is.
So it takes time for you to get used to the climate. The climate is entirely different back home.
Yeah.
Um, and the way of learning, way of teaching here is entirely different. So you need to get used to that as well. But all in all, I would say the processes that helped me bring to UK was almost streamlined. Everything was perfect. Like since the day of joining, everything went well. Everything was all right.
So did you
Yeah.
face any challenge at all? What what
During
what what would you say was a difficult time for you? Did you experience anything and you wish you never came to the UK at all?
Yeah, the real challenges started as soon as I started my job in the hospital. Like, after my OSCEs, I started as a pre-registered nurse. After that 4 weeks of training, you go into the pre-registered nurse phase. Um, so I was waiting for my OSCE results to come up, and this was really a challenging phase. It's for the first time you are in a new country, meeting new people. So it's the very challenge. It was really challenging. I still remember like going into the clinics. Um, so I'm not quite sure. If I'm being honest, it was really challenging. I didn't feel really quite welcomed,
Yeah.
to the ward because there are like different kinds of people you meet at clinics. They expect you to work as they used to because we are new. That was not considered. Like we are working in a new place, a new culture. These are they expected from me or the people who came with me to
Yeah.
work as it used to be. Like you can't expect that from a new someone coming to a new place. You have to get used to, or the people along with you have to train you on what you need to do and how to speak to people. There were like lots of challenges then. It was really hard for me those days in my during my first job here. So this is my second place of work.
Okay. Yeah.
So
So
the
that was the
experience,
first place of work. Those were the ones who brought you to the UK, right?
yeah. I wouldn't say like all the people were, uh, 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 you know, like that. But then there were some people who really helped me as well, like a few people, I would say. But most of the people,
We'll come to those people that helped you. But let me ask this question. Did you face
yeah,
racism?
yes, obviously, there were people looking towards us like, why is this guy here? I felt it. Yeah.
I see. Mm,
Although the ward was short staffed and no one was, they work in their own pace and stuff. The ward was short staffed. It was a very busy ward, like around 44 patients, and you are assigned patients, and they look at me like, why are you here? um, the way they communicate, you feel in your mind like you are not
yes.
welcomed and you're
You're
not one of
welcome.
them.
Mm,
Yeah. Because I had like I did expect some. Honestly, I did
okay.
expect some because there are different type of people. So for sake, they will behave to you as if you are welcomed. But in their mind, when you come into the real circumstances with the patient care, you get these background complaints, indirect complaints coming to you.
Yeah.
Although people who seems to be friendly. So I'm kind of like a straightforward person. So when I see you, if I smile, that smile is of I'm honestly smiling at you.
Okay.
So there are people like, so this was one of the first things I noticed. I was not quite used to these sort of behaviors, like you smile at someone and then the next day you get a complaint from the same person directed to you. So
Yeah. It
so
was
I
quite
wish, like,
confusing. Their
if they
culture
had
was,
corrected me. Yeah, if they
yeah.
had corrected me and and corrected me, and if I did something wrong, that's all right. That's my mistake. So instead of
So,
correcting someone,
so
you
instead of
you get.
correcting you, you will get a
Yeah,
complaint the next
yeah,
day saying you did this, and probably you had a conversation with this person and they smiled and it was like nothing
yeah,
happened.
yeah. So I thought was what I did was right. So you get the message. What message did you get? Do you get, like, when someone is friendly with you, when you do something wrong, they say it's okay, and then you get a complaint from behind rather than correcting you. So that's the
Yeah.
that's not a positive way of positive professionalist way, I would say. So for a professional, what so these these negative things that I got, I I took it like as a learning thing, so that I don't do that to people. When I work with
Yeah.
someone, I always correct them. I always correct them, and then doesn't give like fake smiles or appreciations. So you need to be appreciated, but for the correct thing.
Yeah.
You need
So can you tell us?
yeah, yeah.
Yeah, sorry to cut you in. The support you talked about, you were about to talk about the support you got. How were you able to cope with these challenges that you faced?
You don't. So when I came in, I didn't know anyone who came along with me. Besides, there were some people who shared the same language, but besides that, we always used to get together and share the problems that we faced. But there was no solution for the problem. We always, whenever we met, the people who came along with me, when we met, we used to share the complaints, the
Yeah,
difficulties that we faced, but no one had a real solution to the problem. I had a like a perceptorship training, I would say. So I'll take that an example. It took like 1.5 years for me to complete that perceptorship training.
hmm,
Although the practice development was involved, it seemed to me like they were helpless, because I was
oh,
raising things again and again, and they were saying it to the manager regarding my the perceptor whom I was assigned to. It was changed like 3 times during my perceptorship period. So I had to literally take some strict measures to complete that perceptorship program. Like it is almost it's a 1 year program, basically, the
yeah,
perceptorship. uh, and there were like lots of things even after completing that perceptorship I wasn't aware of, like uh, it's not clinical, it's not of clinical things, but how a discharge take place, what are the facilities, how a discharge happens. There are different pathways of discharge,
Yeah.
We are not familiar to the community things here, but then the people I worked with expected me to know these things without letting me know what it is.
Yeah. It's quite
So
challenging.
yeah, you work in a confusing environment. No one had time. You work in a ward with 44 patients. You don't have time. You don't have time to sit. You don't have time to break. Time for your break. And it was really mentally and physically challenging.
Yeah.
uh, yeah,
I
I
see.
thought of at one time, like, of leaving the place, at some at some point, yeah. But then I decided, like, I've came here, I will, uh, you know I will get over it. I will get over it. I'll find a way by myself, because I fought alone. I came here, there was no one
Yeah.
to help me. I did things
So
on my own.
yeah. So can you tell us what you then did? The progress you made.
Yeah, so after like 2 years, I was there for like 2 years. I was a bit confused. No one was willing to move on. Like, no one was willing to try to go into a new trust, or trying to get into a new position. A lot of
Yeah.
them were afraid. Like, they were really afraid of taking up a new job. They were confused on whether it's going to affect their the visa process, and things like permanent stay in UK and citizenship. They were unaware. But what I did was, I did my own research. I asked a lot of people around me, but I didn't find any information helpful. It is always better to do research by yourself. Go into the government of UK site. They've got all the details. You get in there, you get every information. And besides, there are channels like yours, like, you provide like lots of information to people around. This is like, yours is like really helpful. I've been following yours.
Yeah.
uh, yeah, so there are like lots of YouTube channels. You can get things from anywhere. Some people who are already here like for 10 or 15 years, they give you information that are not current.
You're
They try
correct.
to,
Yeah.
yeah,
Yeah.
they try to discourage you, I would say, from going
And
into.
make you afraid and
Yeah, yeah,
make you fear.
I had like lot of experiences, like people saying that it is not advisable to take up a band 6 post. It can be really challenging. You'll not make it. There were like lots of people saying that, but what I thought that I've been through a lot. I've got my own experiences. I can manage it. And besides, in UK, l- you get the opportunity to learn. You don't have to do anything that you don't know. You
Yeah.
can ask. You
I
can
like
ask.
that.
So the next thing I looked for was for a better trust to join. So
Okay.
I did research again. So what I did was, it was so my wife, she did help me a lot with these things. Like, you can't do all things by yourself. So
Mhm.
from I looked for opportunities from Scotland.
Okay.
uh,
Why
because,
Scotland? Why were you thinking of Scotland?
yeah, because one of the challenging things I faced when I was in my previous trust was the cost of living was too high for me.
Cost of
I had
living.
my
Yeah.
family with me. That was one of the factors. Then I needed a place where you get a lot of opportunities for learning. So what
Okay.
I did was, I I basically scrutinized trust. I looked for their CQC ratings, and what happened, what went wrong, the workforce, the place where it is. So I basically scrutinized and brought it down to 4 or 5 trusts that I can apply to.
That was indeed a great research you did for you to be
Yeah,
checking
yeah,
the CQC rating, the
yeah,
workforce and everything. It was quite
yeah, yeah,
a good one.
yeah. So what I did was, I applied to these 4 particular trusts that I had in my mind. And the
Okay.
first call that I received was from the trust that I'm working now, University Hospital, Derby and Burton. Um, so uh, th- it did seem like Derbyshire has got lots of opportunities. Derbyshire, they have got a specialized course as well. So there were like few things that made me join the trust. Like, one of the main thing was the learning prospects. Like, how you know, and it did. After getting the job, you know, the I was really happy that I have joined the right place.
Yeah. So did you get good support on joining, or did you still face the same challenges you were facing in your
No, no,
previous?
no, no, no. This place where I'm working, I'm honestly saying to you, the place where I'm working seem to be more like people working on common sense rather than on policies. The previous,
I
yeah,
like that. Yeah.
the previous trust was more of policies. Like you cannot turn right or left. There were like lots of policies with you, and people try to intimidate you with those policies. So you
Mm,
were afraid to work. You couldn't basically, you didn't have that freedom of work. I was really scared to work because they had like hundreds of policies around. And if you
yeah.
take all these policies into consideration, you can just stand still in your ward. You can't do anything.
And not work at all. I feel.
Yeah, yeah. You are you'll be scared. But the policies here, in this trust seems to be more like practical ones rather than you can make up policies, you can make theories, you can make philosophies and all the stuff, but it's not necessary that it works to the grassroots level for the
Yeah.
normal
Yeah.
people. It makes it difficult. You sit in the administration and you can make lots of laws, but you have to keep in mind that whether it's going to work in the ward, in the
Yeah.
clinical
With those.
side or not.
Yes. Yeah. The clinical side.
Yeah.
Yeah.
So for
Yeah.
this trust, I seem like there were not like they do have like good policies, but then it's not like limiting your job role, or you are not scared to work. You're
Exactly.
free,
Okay.
free to
That's
work
good.
here. I still have my friends still frightened to go into a new organization or look
Oh.
for. Yeah, I do tell them my experience. Like you can take it, you can learn things. They will teach you what to do. You can ask for it rather than being working scared. There are still my friends working in the previous trust still scared. Whenever I visit them, they have got complaints about their working environment and the daily things that they face. They still face the racism. I told them, just get rid of it. Why are you taking it? Because ultimately you're going to take it, you're mentally, and you're going to bring it home. Your family life will be ruined, everything will be ruined. At some point you break down, isn't it, Sam? You
Yeah.
break down.
That's it.
There is a
So yeah,
limit
yeah.
for
I
me.
want you at this point to tell us what you wish you knew earlier on compared to now. Probably if you had known all this stuff on your arrival to the UK, it could have probably changed maybe some ways you did things, some of the decision you made. So tell us, what things did you wish you knew now that you would have, if you had known earlier on, it would have made a difference?
um if I had a good idea of how things work, what I recently learned was like, mm, you need to basically know how NHS works. That's one of the things that you need to know. You need to know how NHS works, how people are being provided package of cares, how people are discharged, how basically it works. What is a foundation trust? What is an NHS foundation trust? You need to know
Mm,
how it is funded. You need to know the finances. You need to know everything about the place where you're going to work. Because back home, we either work in private hospital or government hospitals. But you know how it works. You need to have a good idea of how things are,
yeah,
and you need to have like some good connections with people who work in different roles, and get a and speak with them and learn how they do things, and rather than going around people who doesn't know anything, just make an idea by yourself, like what what is going to happen, what I need to be in the next 5 years or 10 years, what my position should be. You need to have a good idea of how what a band 6 is, what a band 7 is, what a specialist nurse is. You
mm,
need to learn, you need to go into the networks, or you need to join the there are like lots of NHS things, learning things, and groups as well. So you go in there and see how what people what opinions they share regarding their working, so you get an idea, and then you can plan from there. Because when I came here, I just knew a registered nurse thing. I didn't knew there was like lots of specialities. Like I didn't knew how to get there.
Mm. So
And
what you're
besides,
saying, the first thing is to know everything about your workplace first, like the
yeah, yeah,
NHS, everything
obviously,
about it. So you
yeah.
didn't know that when you initially came to the UK.
I just knew that NHS is like is something like a publicly funded hospital setup.
Hospital. Mm.
Yeah. Besides that, I didn't knew how it worked. Like how things work in the NHS. So I came to know about it later because out of my curiosity, I was continually learning to know what things are because there was no one telling me. Or whenever I
Mm.
ask someone, most of the people doesn't know. But the advantage of knowing these things is for you. It's not necessary, but if you know things better, you can plan your things. If you know how things work, if you can confidently say to someone when you speak, when you go for an interview, you can put
Yeah.
all these points. These are all like the learning things. It's not a waste. Like it will be better for your future, your career prospects. So know things around you, what's going on, how
I
things
have a
work.
question,
Yeah,
but before I ask, for our viewers watching us, if you have any question to ask, you can type it on the chat box and I will read it out for Yaya. I know your Indian community is quite a large one in the UK
yeah,
generally,
yeah,
and
yeah, yeah,
your population is large. Did you
yeah.
connect with, because you talked
Oh,
about
that. Oh my
connection with
God.
people in different roles? Did your
It is
Indian
really.
community help?
It was unfortunately, I would say it was really not a good experience for me. I would say I did
Okay.
try to connect with lots of people. People were looking at me like the same way that the same look that I received when I went into the ward. My same community looked at me the same way. They thought that I was here to take their kids' opportunities. Yeah,
Was it like
yeah.
that?
Yeah, yeah. I did. I did. I was forced to join one of the groups, although I didn't want to because I didn't like the way, the people who were in here for 20, 25 years behaved. So
Yeah.
I was forced to join one of the groups, and I came around this thing saying that these people, they're coming in large numbers. Why don't they look for jobs back home? They're taking our kids' opportunities. I did came around that. You'll be astonished. Yeah, there are people thinking that way. Yeah.
Wow.
And they're not aware of the things, the how the nursing has evolved over the years. They are still stuck in those
Yeah,
past.
there's this talk, yeah, with their
Yeah.
old ideology. I see.
And they do try to blame you all the time. So while I was walking once towards my hospital, I used to walk to the workplace. Someone from my Indian community stopped me in the middle, and he started saying that you have to keep right on your track. Otherwise, people are going to judge you and they will blame the whole community. Things like that.
Okay, I see.
Yeah, people
Oh,
unnecessarily getting into your day-to-day life, and they don't even give a chance for me to ask their name. They just go away quickly, as if I know their name and details, I'm going to ask a favor from them.
yeah,
Yeah, so they were not really quite welcoming.
helpful. Okay.
Yeah, so that was there are lots of reasons for me to change my workplace.
Mm,
But you learn things,
that's,
whether to how what people to be with, not, and what people not to be with.
yeah,
uh,
yeah.
you learn like lot of things. mm,
That's,
but I would say like I will not generalize what I'm not
no,
generalizing what I'm
definitely.
saying.
Yeah, I know. It's
There
just your
are,
own opinion and it's
yeah,
your
there are
experience.
like good people as well.
Yeah,
There are like good people
definitely,
as well, but it's
definitely.
difficult to find good people, you see.
Yeah. But there are still, I
Yeah,
know. So, what other things do you think you wish you knew that would have actually helped? Because now you've talked about knowing everything about your work, talking about connections with people in different roles. I know
yeah,
probably that has actually did help you get the current role you are in.
Yeah, yeah,
And then
yeah,
you
yeah,
talked about learning about the different specialty and also having your
yeah,
own plans,
yeah,
basically. So is there
yeah,
anything you would have wished that you knew? Probably we could leave the workplace now. We can now look at
yeah.
the community. How did you then adapt into the community, interacting with people in your neighborhood and all those stuff?
So basically, I after going through all these things, I realized that I have to, minimize my connection in the community socially. So I picked up the good people who I'm comfortable with,
Yeah,
rather than getting into, knowing all the people around. That's not going to make any difference to you. So in here, you have come to work. Basically, you have come to work. So you uh, choose the people that you want to be carefully. It should not be like someone toxic, like always discouraging you. You should be with people who are always encouraging and have the same passion as you towards the profession.
yeah. So
So
you
just be
surround
very
yourself
careful in
with
choosing people around you.
positive-minded people.
Yeah,
Yeah. Yeah, yeah. Do you have any advice for our viewers today and those that will watch these videos? Because I know a lot of people are still struggling, just as you even said, even
yeah,
some of your friends and colleagues in your previous place, if not that you took the bold step of finding another job, you would have still be there. There are some persons that are really struggling at their
yeah,
workplace. They relocated from wherever country they are down to the
yeah,
UK. They are either working in a care home, some are
yeah.
working in social care in the hospital, some NHS, but they are finding it difficult. What would you advise them to do?
I would say that because you're in a new place, you you should expect, like, you're going into a very challenging situation. That's the first thing. You need to make up your mind that you're going to face like lots of challenges. I'm kind of like that person. Like, I expect the worst, and if you get something good, that's a bonus for you. So you need to make up your mind. You need to be strong, and whatever things that you get, negative things that you get, try to make it positive for you. Try to make it as a learning experience for you. Like, if someone behaved to you in a bad way, doesn't necessarily mean that you should be behaving the same way when you get there. You just take it as a positive thing. Like, make it positive for you. And try to avoid places which are mentally and physically exhausting you.
Mm.
So that's not what you're here for. You need to
Yeah,
make the decisions as soon as possible. Don't let it delay. If you delay, the thing is that most of the nursing, I know like lots of nurses who end up in the same workplace, always complaining for 10 years and 15 years. It's not going to work. It's not going to make any change. If you want a change, you make a decision then and there, and then come up with a plan. Take your time. Don't tell anyone what you're up to. Make up a plan. Make up a clear picture. Like, it might take like it took me like around 4 or 5 months to come up with a definite plan. But I had made up my mind 4 months before, like, I'm going to leave this place.
yeah.
And in those 4 months, what I did was I did some background work. So luckily, I got, I think, my phone. Sam, if you could please excuse me, let me get my charger. My
Okay,
phone
okay,
is
that's
on.
all right. That's fine
Yeah,
then. So, guys, if you have any question that you would want us to ask Yahya, please, the chat box is open for you. You can actually do send your question. We'll still be expecting our second guest, Joseph Hige. He had an emergency this evening, and hopefully he's able to sort out the stuff and join us as soon as possible. But hopefully we will definitely get Joseph back on the show um, when he's free. Uh, Thank you, yeah, because
yeah,
your
yeah,
advice is actually
yeah,
going well with us. We
yeah.
need to avoid places that are physically and emotionally exhausting. Uh,
Yes.
we shouldn't just be complaining. You keep complaining and you are in the
Yeah.
same place, nothing is going to change. So if you
Nothing
want
should be changed.
change, as you said, you make a plan, and then
Yeah.
you make sure you keep it to yourself, and you do your research. You're talking
Yeah.
about doing some background work.
Yeah. Yeah.
Yeah. So
So so I had like a positive experience from one of the colleague who was looking for a better option. So she was in UK for like 20 years, and then she decided on moving on to a band 6 role, although I did encourage her to move on to that role. And she was one of the factors. She helped me a lot to get on with the interviews and things.
all right.
So how to attend the interview, how to although I did like 3 or 4 interviews before that for the same post. I did an interview in a care home. I did an interview in like 3 different trusts, but it didn't come up with a positive result. But what I learned was I'm not on the right track. Once you fail an interview, doesn't mean that you are not fit for that post. You shouldn't
Exactly.
be disheartened. So my when they ask you a question in an interview like uh, tell me about yourself.
Yeah.
So I was in my for my first interview, and I did tell them the whole history of my the whole biography, like since I was born.
Yeah.
Yeah, yeah,
Yeah.
it was really funny, but then I came to know that it was not the expected answer.
I see.
So from failures you learn. Again, the failures, if you fail in an interview, doesn't mean that you're not fit for
You're
doing
not
that,
good.
or
Yeah.
you are a failure. Don't think that way. Just take it positively. You learn what went wrong, and then correct it for the next interview. So after three
Definitely.
or four interviews, I would say, like, some people get it like in the first or second ones. So mine, I had like 3 or 4 interviews before. So I got it on my fourth chance, and my interviewer was quite impressed on how I performed.
Sorry, I wanted to ask, did it ever cross your mind when you didn't get it the first, second, third time that they didn't give you the job because they were racist?
Um, Not really. It was basically my performance was not well. The interviews
So
were basically depends on.
So even you examined yourself after the interview and you
Yeah,
felt, I didn't do so well. Because I
yeah.
know some of my viewers or some persons might believe
Hmm.
that if maybe they've gone for an interview, they didn't get
Yeah.
it, they will say, maybe they already have somebody that they want to give the job to, and that's why, or something like that. Did they ever cross your mind or so?
No, because I came to know about like lots of stuff. The thing is that for after the interview, when you don't get an interview, you do an introspection on what went wrong.
Yeah.
So the first thing that you check into, the first thing that I checked about myself was what went wrong with myself. But then only I'll go to the second option. If I performed well, if I felt that I performed well, then only I will go to the next option about the interviewer, the one who interviewed me. So the first instance was the thing was wrong with me, so I didn't have to go into the next step.
Next one. I see. Okay.
So if I had performed well and I didn't get an interview, so you have to do like quite a lot of work. Like, did you really do well? So you have to go through the questions and see whether you have answered. It's not lot of like clinical questions. Basically, these are like questions based on trust philosophies, trust policies. These
Okay.
were the main questions that were involved, rather than how which medicine are you going to give the patient, what will you do when you give this medicine. Besides
Yeah.
these questions, it was more focused on what do you say, like the principles that's guiding the trust, like compassion, the 6 C's: care,
Yeah.
compassion, competence. Yeah. So I got to know that I was the problem. So if I was not the problem, then only I will go into the next step of analyzing what the other reason is.
Okay.
So this was basically like it was like really a learning thing. Interview is a big thing. Interview is really a big thing, and you have to be prepared for that.
That's true. Because
So
even getting to be shortlisted first is actually a big thing before you get to the interview stage.
yeah. So I recently had an experience being an interviewer for an HCA. for recruitment. So I was
Yeah.
part of the team. I just wanted to know how things work, how they see things. So I noticed that they look into each and every behavior that when you come into that interview room, whether you are, you know, what your attitude is. So while I was doing that interview, uh, I was not looking into these minute things, but the people who were experienced interviewers who were sitting along with me, two other people. So when this particular candidate, she completed her interview and she went outside, and I asked them, "What is the problem with this candidate?" I didn't. So didn't you see that she was having a chewing gum in her mouth? I didn't notice.
You didn't
I didn't
notice that.
notice. But they so what I understood was they do notice these sort of small things coming into the interviewing room and putting the charger on and your phone, charging your
Yeah.
phone.
Yeah.
you
They
know
wouldn't.
these are kind of like they do need to feel that we require the job and we are passionate about the job. So you have to be prepared with those sort of things. But again, there can be like biases. Again, if
Yes.
someone
Yes.
there can be some biases, like when someone does, they don't care. When someone else does, they do care, like things like that. So
Yeah.
it's so if you really want that job, uh, make sure that you are 100% all right. You are all right. You don't look into other people. You don't look into how other people behave. You be yourself. You
Yeah.
just, yeah.
So what you would advise our viewers today is that they shouldn't give up, even if they don't get it
Yeah.
first, second, third time, fourth
Yeah.
time. They could get it
Yes.
definitely.
Yes. Obviously, you will get it. You will be there if you are passionate on what you're doing, and you have a clear idea of what you're going to be in the next 5 years, and you are
Yeah.
in the correct planning phase. You will get there. You will eventually get there. You will get more than what what you imagine. I would
Yeah. Yeah.
say,
We have
yeah,
a question here.
yeah.
One of our viewers is asking, can you tell me about the pathway to becoming a specialist nurse or enroll in preceptorship in theater or operating room? And he's also asking, is the preceptorship and specialist role the same?
And so I was saying about the preceptorship for the international nurses. Preceptorship was designed basically by the trust to see to make the newcomer aware of what's happening, what's going on, and then they need to assess you on whether you have understood what's going on around you, how the ward works, how you need to be, how you're with the patient, regarding the infection control, everything that happens in a ward. Like as a newcomer, that's what the preceptorship I meant, like for the international nurses or someone new
Yes.
coming to a trust.
Yeah.
So if you go through the documentation, you can see all these stuffs in the preceptorship booklet. It covers like the whole thing that you need to know working in a ward. But unfortunately, things become like ritual when you don't have time,
Yeah.
and you don't
So
always get the opportunity to get signed off for the actual thing there. Rather than just asking, and they will ask you questions. The preceptorship can be done in two ways. Either you show the things, like an nasogastric feeding. So if you don't
yeah.
have a patient with nasogastric feeding, so what the preceptor does is like she asks you questions. That's quite easy. You can answer it. But when it comes to don't have the learning time or you don't have the time to show it to the preceptor, um, it's a different thing.
Can you just talk briefly about the pathway to becoming a specialist nurse? So what should this nurse do? Because probably they want to become a tissue viability nurse, a diabetic nurse. What's your advice? What are the pathways? What things should this person do to become that specialist nurse?
Pathway is quite clear. If you're a band 5 registered nurse, get on to being a link nurse for whatever specialty
Oh,
you wish to. That's the first
okay.
step.
Yeah.
Be a link nurse. So be a link nurse and make sure that you get all the training and courses or the meetings for that particular link group in consultation with your manager. Again, you need to be focused here. So because of the busy environment in the ward, sometimes you feel like, oh, I'm not going for that. I just want a day off. but you need to be a bit focused. You need to have an idea of, like, in 2 years I'm going to be this. So when you become a link nurse, you get to know people who works in that particular department and the new things that are happening there. So, like, for example, tissue viability. You become a tissue viability link nurse. You get all the new information. You get all the new information happening in the trust, and new the wound care programs, the new dressings, the things that's coming up. Um, and you get to know these people, make a good connection with them, always stay in touch. And also you get an opportunity to teach other people when something new is brought up in tissue viability. Suppose they are bringing in a new sort of dressing, or they are changing the whole thing and bringing something new, so you will be in charge in that ward to spread that news. So you get a teaching opportunity. So teaching opportunity, I would say, it helps you learn better, and people looks up at you to see like how you work. You show them how it works, so you get more used to it. And the first thing I would say is the link nurse. Be a link nurse.
The link
Make
nurse from
connections
there,
with people.
opportunities
And,
come up.
and and yeah, and when you speak to people, when you know people, ask them like, when an opportunity comes up, just let me know. Or just if that's not working that way, just keep an eye on new opportunities for. So that can be an advantage when you go for an interview, or for that
Yeah.
specialty.
Okay. Thank you very much, OJ Victor, for that question.
Yep.
And Yaya has really elaborated on this. You have to be a link nurse first for that specialty, and some trainings could come up, and you have to be very, very focused and keep your connections. Shitu Messi is saying at times, talking about the interview we talked about, at times you might score well, but you still don't get the job because of preference. You might be lucky to be placed on waiting list if the interviewer wants you. So it's just a statement
So
to say, yeah,
usually,
probably sometimes you
yeah.
might.
So what, from my experience, I would say that an interview panel will have like three or four people. Uh, there will be someone who can influence as well, like a senior most member. So when I was in the interview panel, there was a senior member. Um, it all depends on um, the number of people that have applied. I'll start from the beginning, like how they bring down the numbers, like how they make it. Like, I had a friend of mine who applied for a post. Like, it was only two posts and 100 people have applied for that. Only two got it,
Yeah, 100. That's a
because
lot.
these days they tend to reduce the number of the opportunities are a bit,
Yeah,
they are constricting the job opportunities. Um, the thing is that they will, so any small mistake from your part will be taken into account if there are like large number of applications for the same post.
yeah.
uh, Regarding how, I haven't quite given a thought about it, like, because
So yeah, I think what she's trying to say is that
mm,
sometimes you might do well, and
yeah,
probably they have just one position um, to offer. So they
yeah,
might then put you in a waiting list. So there's always a
yeah,
waiting list. Probably another position comes up in the future, maybe within four to
yeah,
six months. They wouldn't want to go through the whole recruitment process. They just go back to the waiting list and pick those that they've already interviewed to say. So, for example, we talked about being a tissue viability nurse. So probably they've done an interview and they only have one post to offer, but they had like very good three candidates that
yeah,
performed very well. So they will
yeah,
offer one and put two on waiting list.
yeah,
So probably in the next 6 months, another opportunity comes up, but they really don't want to go through the whole interview process of advertising, shortlisting, creating dates for interview, and all those stuff. They then visit their waiting list to say, "Are you interested in this position? Are you still available? Would you want something like this?" So I think that's what she was just saying, talking about the
so
waiting
what
list.
I
So
would
some
say is,
trust do it,
before
some trust
you,
do it, but
yeah, yeah,
not all trust.
yeah. So what I would say is, like, before you go for it, make sure you've got a job with you. So when you go for an interview while you're working, you are confident. You are the master. I would say you're the master. You're in charge. Like you
Yeah,
decide whether I want to take this job up or not. And
exactly.
if someone says that you are on waiting list, don't wait for that waiting list to come up. You're not going to
Exactly.
wait for them. It is you who's making the decision. You decide what is going to happen to you, not other people. So if they put you on a waiting list, you look for the next opportunity. Don't wait for
Yeah,
anyone.
definitely. Definitely. Definitely.
Yeah, um, because you already are working. You're not afraid of anything. Just these are the things. These are like some personal psychological things I take in my mind. Like when I go for an interview, you have a job. You don't have to be afraid of anything. But on the other side, if you don't have a job and then you're going for an interview, it's a bit difficult thing.
Yeah.
So just don't wait for those waiting list. If they are in need. The people who are recruiting, they are in need of us. So they have missed a good person. That's it.
Yeah.
I am good. I am good. I
That's
am passionate.
that's
I can get
that.
any job I want. Just make yourself positive. You are not less than anyone. You are the you just have that confidence in your mind.
Yeah. Thank you very much, Yahya, for a very interesting and inspiring and motivating session. And thank you, my viewers, today for your attending. Okay, there's a question here. Ojo Victor is saying, thank you, Yahya. You have been brilliant on set with all you shared today. Thanks, Sam. Amazing work with this channel. Shitu said, yes, Sam, you got my point. And Shitu is asking a question here. Yeah.
Yeah.
How do you get on the AMP pathway if there are no trainee AMP opportunities in your trust?
I've been looking forward to that as well. I did have had a conversation with one of the practice development team members regarding the ANP.
Yeah.
But still, I think Derbyshire is offering a different form of ACP. I think it's called ACP, almost similar to
Yeah.
the ANP pathway. But that's only Derbyshire. I don't think any other places offer that one. But if you get into the University Hospital Derby and Burton, I think uh, you can opt for that pathway because I don't have a clear picture of how you can
How
get
you
into
go
the
about
end.
it, right?
Yeah, yeah.
So I think basically I know some trust through the educational departments, they could render some trainings. Now, some trusts have some memorandum of understanding with some universities.
Oh, yeah, yeah.
And my previous trust, I know they have some MOUs with the university that's close by, and they
Mm.
could also offer a training pathway with that. Also, you could look for, what I would advise is you could look for a training course, probably with a university, and write to your CPD team or your educational department for sponsorship. So you are entitled to some CPD funds, which you can actually use for some training courses. That is one pathway you could use, because some they do some training AMP that you could also work and do the training program together. But you can also take the bold step of looking for these courses, maybe with a university, getting through the cost, and write to your CPD team or your educational department for sponsorship. That could also be.
I think working in the ED or ANE is an advantage for applying as an ACP. I think so
Yeah.
because one of the questions that I got from the practice development was like, do you have any experience? Or the acute medicine side.
Okay.
Or,
Okay.
because things are more of medicinal, and you need to have a mentor as well. When you go for, you need to identify a mentor as well. Like when you work in the clinics, you need to have a mentor in place, like
Yeah.
someone who's a senior ACP to sign
Yeah.
you off on things that you're doing. Uh, I haven't looked further into that. I think Sam, you have got a big topic there for your next
I
set
do.
episode.
Yeah. I remember you talking about let's having a discussion about some specialist pathway. I think we
Yeah.
would visit that then, since a
I think
question
this,
is.
this Derbyshire pathway is a different one. You could do some. research for the viewers, because that's not utilized much, I think so. Although the
That's
last cohort was full. There is a Derbyshire pathway. I think it is called ACP. I'm not quite sure. We do not ANP, not
mm,
nurse practitioner,
okay,
but
that's the
ACP.
AACPs. Okay.
Yeah,
Shitu, Mrs. Shitu, I'm not sure if we answered your question, but I think we'll have to
yeah,
revisit it, do some more research, and
yeah.
probably I could send you the outcome probably later on, if that's all right. Thank you very much, guys, for joining. Thank you, Yahya, for your time today.
Thank you, Sam. You're welcome,
Apologies,
Sam.
Joseph could not join us today. He sent a message that he had an emergency um, this evening, and it was something that he could not miss. Hopefully, we'll bring Joseph back to the channel and also hear his side of the story and then what he wished he knew pending proud to come into the UK. Thank you, Yahya. And for those of you who have not subscribed to my channel, please do so. Hit the subscribe button and turn on the notification bell. And when we post any videos or any of our programs coming up, you'll be the first to be notified. Thank you so much. Thank you for joining. And I
Yeah,
hope to see you guys soon. Thank you, Yahya.
bye.
All right, then. Thank you.